I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. Every year, chronic wounds and other conditions keep millions of Americans from enjoying their best quality of life. CHS's Centers for Hyperbaric Medicine and Wound Healing apply evidence-based clinical practices using advanced dressings and hyperbaric oxygen therapy to help heal patients suffering from chronic and non-healing wounds. To speak more about hyperbaric medicine and wound care, I'll be joined by Dr. John Jackalone, co-medical director of the Center for Hyperbaric Medicine and Wound Healing at St. Joseph's Hospital and Mercy Medical Center, and Dr. Morad Awadallah, medical director of vascular and endovascular surgery and co-director of the Wound Care Center at St. Catherine of Siena Medical Center. Please stay tuned for today's episode of CHS Presents Health Connect.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
We women sure know a lot of numbers by heart. But do you know the most critical numbers for your heart health? That knowledge could save your life. Do you know your numbers? Talk to your healthcare provider today to learn your health numbers. Your heart depends on it.
Here's something we bet you didn't know. Nearly half of all cancers can be prevented, mostly by making changes in your diet, controlling your weight, and of course, by not smoking. Visit prevent50.org and get a free 30-day planner filled with tips, recipes, and more.
Welcome back to CHS Presents Health Connect. Approximately 5 million Americans suffer from chronic open sores that can become seriously infected, gangrenous, may require surgical procedures, amputation, or even cause death. Hyperbaric medicine can provide relief and recovery for chronic non-healing wounds. Joining us now is Dr. John Jackalone, co-medical director of the Center for Hyperbaric Medicine and Wound Healing at St. Joseph's Hospital and Mercy Medical Center. Welcome, Dr. Jackalone.
Thank you for having me.
It's great having you with us again today. Tell our viewers at home again a little bit about what is wound care and the types of treatments that are offered, and when should a patient call the doctor regarding a wound?
So a wound care patient is, for us, is basically someone who's suffering with an opening or a wound. Could be traumatic, It could be post-surgical. It could be related to their diabetes or their circulatory disorder. Anyone that has a wound that's not closing in a reasonable amount of time, and what do we mean by a reasonable amount of time? Well, if you've injured yourself in the past, you know how you should heal. If you feel that this particular wound is not following that pattern, I don't want to tell somebody a number of weeks, because a chronic wound for one patient may not be chronic for another. So if you're concerned at all about a family member or a wound that you have yourself, absolutely reach out to your doctor. You should never be made to feel like you're bothering anyone. He'll let you know, this probably should be healed by now, and maybe we need to send you, in the appropriate direction. So I think it's any wound that doesn't look right or seem to be healing the way you've healed in the past.
And this is so important because, as I mentioned in the introduction, if one of these wounds don't heal and it does get infected, it could rapidly spread to serious limb-threatening infection or perhaps even life-threatening infection. What's some of the statistics, man? How common is this?
A majority of patients that have diabetes for a long period of time at some point in their life are probably going to develop a wound. With diabetes, we talk about how long you've had diabetes. I personally would rather a patient tell me that they've had diabetes for 6 months and their sugars have been on the high side than someone tell me they've had diabetes for 20 or 30 years and their diabetes has been somewhat well controlled. It's a cumulative effect, and our bodies break down with time. Statistically, it's something that most diabetics really have to be careful about and look for, and family members also. Sometimes patients don't want to burden their family members. They might be a little older, they don't want to burden their children. It's really important to ask mom and dad, take your shoes off, let me take a look.
Yeah.
Happens all the time where they come in and the child will say to me, I didn't know mom had this wound. I didn't know dad had this wound. So it's very important to be diligent, especially with the lower extremity where diabetes is concerned.
It's interesting with my father. He had said to me one Father's Day, I got him a gift certificate to go get a pedicure. And it's so important. He's a diabetic. Many times it's hard for him, given his body habit, is to get down, check his toes, check his feet. It wound up being one of the best gifts I could give him, because ultimately sometimes what can happen is you get a foot wound that could rapidly expand, grow, and cause significant problems for the foot and whatnot, and lead to systemic infection. Are there other diseases other than diabetes that can lead to problems with wounds healing? And
Sure. Anything that affects your circulation, your ability to sense and feel pressure or injury, or your ability to fight infection. Circulatory disorders, neuropathies that could result from some type of environmental exposure.
where you have no feeling.
That's correct. So, you set up this perfect scenario where they can't feel pressure or pain, they develop a wound. Because they're compromised, they don't fight the infection, and they may not have adequate blood flow. And if you think about blood flow, it brings oxygen there, and it also delivers antibiotics to the area. So if you have an injury that's infected and doc puts you on an antibiotic, if that blood flow is not getting to the affected part of your body, as in the foot, furthest away from the pump, gets the least amount of blood pressure. It's got to travel the furthest through arteries that may not be as open as they were 20 years ago. So blood flow, and I know you're going to have vascular doc on next, very, very important part of what we do. I cannot function or run a wound care center without a good active vascular service.
Right, and you actually just, it set a perfect tee up as you talked about oxygen delivery to tissues. So let's talk a little bit and share with our viewers at home about hyperbaric oxygen therapy. How does this help patients suffering with chronic wounds?
So basically, hyperbaric oxygen therapy is one of the tools that we have. A small percentage of our patients actually wind up in hyperbarics. Most patients we're able to take care of with wound care alone. But in the patient that might be compromised from an oxygen standpoint, the way hyperbarics works is very simple. Right now, we're breathing air, and that air is being pushed into our lungs with atmospheric pressure. The weight of the air above us is pushing that oxygen into our bloodstream. When we increase the atmospheric pressure, as we do in a hyperbaric chamber, we're basically pressurizing that chamber with, let's say, 2 atmospheres of oxygen. So we're doubling the pressure gradient that's driving oxygen into the bloodstream, and we're increasing the amount of blood that's getting to the affected body part. Now, again, I started by saying hyperbarics is a tool and not a save-all, because you may have a patient who needs to have that artery opened or bypassed or unblocked by a vascular. Now the hyperbarics will work. So it's not everybody that goes in. The patient has to be optimized, and they have to be able to get the benefit and realize the benefit of the treatment.
But again, it's multimodal. As you mentioned, there's multiple underlying processes that lead to this disease state. But certainly hyperbarics is a key tool in this. Can you share a little bit with our viewers at home some of the successes you had with patients who have been treated with hyperbarics?
We've had patients that have failed traditional wound care therapies for 6, 8, 10, 12 months. I mean, some of the things that walk into the center, you know, they're very impressive. And if that patient is optimized and you put that patient into the chamber, you will see results. If you're putting the patient in the chamber and you're not getting the results that you want, you're probably missing something. So when it works very well and it's very powerful. If it's not working, you need to step back and reevaluate because you're probably missing something. And blood flow is probably that's something that you're missing.
Yeah, understood. And where can folks go for these treatments? Where do we have these services at Catholic Health Services?
So we have hyperbaric centers right now at Mercy Medical Center. We have them at St. Catherine's Hospital in Suffolk County, and we have them at St. Joseph's in Bethpage. So we really kind of have the island covered. It's very important, I think, to be part of this, a larger organization. We're not just in our own little corner of Nassau County. If a patient tells me, you know, I have a family member, but they live out in Suffolk, we can see at St. Catherine's. South Shore, we've got Mercy. We've got St. Joseph's is really centrally located, kind of close to that Nassau-Suffolk border. So we really have most of the bases covered geographically.
And again, perfect segue into one of the things I asked you to do, which is help develop and lead our service line model for wound care. So building off of those centers and hub spoke and being able to service both counties in which we serve. We're just getting this off the ground now. Very exciting. Can you tell us a little bit about the service line?
We were interested in becoming a service line, and the reason for that was we really wanted to plug all the centers together. We want to know what's working. You know, wound care, I don't want to say it's relatively young, but compared to some other disciplines of medicine, it's still developing, and we have a very, very powerful opportunity to drive it in the right direction. But we need to know what other docs are doing and what's working for them and what's not. So by being part of this larger group, we can communicate, we can bounce ideas off of each other, we can create continuity. If your mom needs bypass surgery, and I've been taking care of her at St. Joe's, but now she's going to St. Francis, which is the premier vascular hospital in the area, I want her to be able to use the same products, the same treatment modalities. So we really all need to be doing the same things. And in that way, by creating reproducible results, we can learn from those results and figure out how we can do it better.
Yeah, there's no question. And I think service line development really substantiates that model of increasing standardization, reducing variability. And I know we've done some wonderful work already in standardizing both clinical approaches and also the products within the system. So I really can't thank you enough. And I want to thank you again. It's my pleasure. And I want to thank you, Dr. Jacqueline, for coming on our show today.
Oh, my pleasure. My pleasure.
Thank you. When we get back, we'll continue to discuss wound care. Please stay tuned to CHS Presents Health Connect right here on Telecare.
I never wanted to be associated with heart disease. I never wanted to be the poster child for heart disease. I never wanted people to know that there was something wrong with me.
Going through recovery from open heart surgery or being affected by heart disease can be incredibly isolating.
It's not easy on your body, on a woman's body.
I felt really alone because no one my age really had this problem, never had this issue.
And just knowing that there's a circle of women who know exactly the struggles I face every day and are there for me is so empowering.
I realized that I wasn't alone, and no matter your age or race, I made friends and found sisterhood and really found a second family that made me feel that I wasn't alone anymore.
There's so many ways that you can get involved. You can join the movement, you can volunteer, you can be an advocate, and you can donate. All you have to do is go to goredforwomen.org.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy! And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
He helped
helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
We've been discussing hyperbaric medicine and wound care and are now joined by Dr. Morad Awadallah, Medical Director of Vascular and Endovascular Surgery and Co-Director of the Wound Care Center at St. Catherine of Siena Medical Center. Welcome.
Thank you very much for having me.
It's great having you here. So again, from a vascular surgeon's perspective, tell us a little bit about what kinds of patients are predisposed to getting wounds.
You know, wounds typically affect diabetics, and those are the patients that we worry about most. They have a number of reasons why they're predisposed to wounds. They lose sensation in their feet.
Yes.
Their blood supply is frequently reduced. But we also worry about non-diabetics. There are many patients that have reduced circulation into the foot, known as peripheral arterial disease patients.
Yes.
And there's also patients that have issues with their drainage system out of the foot. And we know those patients as venous insufficiency patients. So those are the type of patients that can be predisposed to wounds.
So again, for our viewers, you know, obviously diabetes creates problems with microvasculature and create problems with diabetic neuropathy and vascular issues. But as you're mentioning, in our arteries, we can develop peripheral arterial disease, so blood not getting down there, and also venous insufficiency back. So it's really about taking good nutrients in, taking waste out, and having good flow in and out. And from your perspective, what are some of the things that you're involved with, as a vascular surgeon, in helping improve circulation? Because as even our last guest shared, if the circulation is poor, despite a lot of other interventions, we're not going to be able to fully benefit the patient.
Well, for example, at St. Catherine's, we have a great collaborative effort between the vascular surgeons and the podiatrists, where the patients are seen in a multidisciplinary fashion.
Right.
They're evaluated by the wound care specialists, namely the podiatrists, who make a treatment plan regarding the wound care necessary for the patient. Those patients are also seen concurrently by the vascular surgeons, where their vasculature is assessed. The flow coming into the foot and the flow exiting the foot and leg are assessed by a vascular surgeon specifically.
So how do you do that? How do you assess someone's vasculature?
Well, a lot of it has to do with physical exam. It's one of those professions where the art of physical exam hasn't been lost. We can tell much of what we need to know by the physical exam. We assess for pulses in the feet. We assess for discoloration in the leg. We have non-invasive testing, which involves no radiation, where we're able to take measurements regarding the blood flow in the foot. We could see how much pressure the foot's achieving relative to the arm, and we can sort of get an indirect reference or idea as to what's the likeliness that the patient is going to be able to heal this wound without an intervention by a vascular surgeon.
Very good. So really a good way of, diagnostically approaching it to look how the flow is in and out of the limb. Who should see a wound care specialist or a vascular surgeon?
Well, I think certainly patients know themselves best. And if they have a wound that's unusual for them, that has not healed after some care, then those patients should certainly be referred. Any diabetic should be referred. Any patient with discoloration in the leg or the shin area, we'll be concerned in those patients for venous insufficiency.
So what does that look like for our viewers at home? So give an example. So if they're noticing some modeling of the skin, or is it a darker tone hyperpigmentation?
Well, there's sort of two different patients here. One is the arterial patient, where they might notice that their foot is pale, or in very advanced stages, they might develop something called dependent rhubarb, where we call it hyperemic, or very intensely red. It may look red and appear as if it should be warm, but it's in fact cool to the touch. The venous insufficiency patients have a different picture. They tend to have a history of varicose veins. They might have a history of clotting. And very frequently, you'll see something called lipodermatosclerosis on their leg, where they'll see a brownish discoloration that's sort of permanent. And sometimes those patients can develop wounds, which, unlike the diabetics, tends not to involve the foot, but might involve the leg or the shin above the ankle.
Yeah. So again, very important if our patients and residents are seeing folks symptoms of that, certainly should get in to see the appropriate specialist.
Absolutely.
Excellent. And what about, you mentioned a little bit about some of the diagnostic testing and the art of the physical exam. Is there an algorithm where you approach these patients when they come to see you in this center?
Yeah, whenever we see a patient for an extremity wound, they have an assessment, as I said, by a wound care specialist. If they are noted by exam to lack peripheral pulses or have some of the skin changes that we were discussed a little while ago, then they're referred to a vascular surgeon, where our particular protocol involves obtaining a measurement of the blood flow in the foot relative to the arm, and we can get an indirect comparison by that ratio as to whether the blood flow is reduced. If we find that it is reduced, or we think that the test might be unreliable for some reason, we might progress to more advanced imaging modality, such as an ultrasound, which will give us sort of a higher resolution idea as to where specifically the problem may lie in the vasculature. And sometimes we may proceed to something like a diagnostic angiogram, where a vascular surgeon will put a small needle inside the artery and then insert some dye into the extremity. And they can get a very high resolution picture as to where the blockages have occurred. Is this affecting the wound? And the advantage of that is, right on the spot, the vascular surgeon can intervene, introduce some stents, reestablish blood flow to the foot. And as we heard from the previous speaker, one of the most important things for a wound is to have oxygen. Hypoxemia is something that will prevent a wound from healing by inhibiting the way collagen binds together. So without oxygen, the wound's not going to heal, no matter how good the wound care regimen is. And so a vascular surgeon's role in this is part and parcel in giving the capacity to not only deliver oxygen, but frequently these patients have associated infections. And in the absence of blood flow, it's very difficult to deliver antibiotics to the appropriate wound bed.
Yeah, I think it's very important for folks at home to understand that this is why seeing a professional is so important, and getting the appropriate examination and diagnostic testing done. And just as we've talked about on this show in other areas, whether it be the heart or the brain, you're able to go in many times with minimally invasive technique, be able to open up a blocked artery, stent it, create better blood flow, which then creates the environment for healing and good blood flow.
That's exactly right. It's much more likely than not that we'll be able to alleviate your lack of blood flow using techniques that involve no incisions at all.
And again, it's the full comprehensive approach. So again, multidisciplinary, everybody working together in one collegial space with the best technology to help provide the best outcomes.
Podiatrist, very important, vascular surgeon, endocrinologist, primary care doctor. It's all one big collaborative effort.
Well, that's great. Dr. Aladala, I want to thank you for joining us today.
Thank you so much. I'm very happy to be here.
It's great having you on the show.
Thank you.
We'll be right back for my final thoughts and health tips and solution of the day. Please stay tuned. And now my final thoughts on our discussion today. Managing chronic wounds can be sometimes very difficult. It's very important that you frequently examine yourself at home. Make sure if you can't get to a certain area of your body, especially down low to your feet, around your toes, have a loved one check you. If you have pre-existing medical conditions like diabetes, even coronary disease, all of these things can affect the way that the vasculature supports the tissue, as well as can set you up for at risk for developing one of these chronic wounds. And even if you do have one of these conditions, please, as we talked about today, where you go for treatment is so important. You have to make sure you're seen by the appropriately trained, skilled healthcare professional team, also with the best technology available for you to provide the best outcome. I always say it's the right care, right place, by the right people at the right time. So please do come visit us at any one of our CHS facilities. And now for my health tip and solution of the day. Today, we will discuss important information about type 2 diabetes. Again, very relevant to our conversation today about wound care. As always, I like to start with one great source of truth, and that is www.diabetes.org. Type 2, or adult onset diabetes, is the most common form of diabetes. It's also known as non-insulin dependent diabetes, and it is a chronic condition that affects the way your body metabolizes the sugar needed to fuel your body. With type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. When glucose builds up in the blood, it can cause issues right away. your cells may be starved for energy, and over time, high blood glucose levels may hurt your eyes, kidneys, nerves, or heart, and even your vasculature, like we talked about today. Some people with type 2 diabetes can control their blood glucose with healthy eating and exercise. But eventually, your doctor may need to prescribe oral medications or even insulin to help you meet your target blood glucose levels. In some cases, the disease can progress over time. Even if you don't need medications at first, you may need them later on. You have to stay on top of this and continue to check in with your healthcare providers. Obesity can be a risk factor for developing the disease, but weight loss can help to improve type 2 diabetes in those who are overweight or obese. Also, some groups have a higher risk for developing the disease than others. Diabetes is more common in African Americans, Latinos, Native Americans, and Asian American or Pacific Islanders. Common symptoms of type 2 diabetes can include frequent or increased urination, excessive thirst, excessive hunger, fatigue, blurred vision, or, as we talked about today, sores or cuts that won't heal. Many times that's a very common presentation I used to see in the emergency room. If you're having these symptoms on a regular basis, you may want your doctor to test for the disease, which is done by a simple blood test. Routine diabetes screenings usually begin by the age of 45. Remember to check with your doctor if you're having a health concern or any symptoms of type 2 diabetes. If left untreated, diabetes will lead to serious health issues and damage to your body. Stay ahead of the curve. Get seen, get treated. That's my tip for today. For more health information, watch CHS Presents Health Connect, airing on Telecare and CBS TV 55. To view recent episodes, go to CHS's YouTube channel. If you'd like to know more about hyperbaric medicine and wound care, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please drop us an email at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.